Hi, everyone. Thanks for tuning in again. I'm Carla Stalling Walter. I'm the author of Dance, Meditation, and Zen for the Black Cancer Patient. And today I'm talking with you about um, the notion of anti Black racism and how to think about changing our thoughts. Um, In our last video, I talked a little bit about how it felt to um, encounter multiple myeloma and that I had not actually ever had a debilitating illness before. And so this cancer and cancer treatment exposed me to the medical and pharmaceutical industries. And I had never encountered it like that before. So, a lot of what happened to me was that it felt like I had no agency, and I was relying on people to help me to get better. But as you might know, some of us in the United States who identify as American Black, we have certain histories that make us a little wary of the medical industry and the pharmaceutical industry. And I would like to say that it is a rightful wariness because in the past, you know, people of color and American Blacks were subjected to different kinds of experiments or sort of not so nice treatments if they were treated at all when they needed medical care. But what I would like to say is, whether you have a terminal diagnosis or not, embracing anti Black racism in a way that helps us all see that we're in it together. Anti Black racism cannot exist if we don't all agree to it. And we have to, I think, really acknowledge how anti Black racism impacts our health in both mentally, emotionally, and spiritually, and to acknowledge the fact that we're in it and we really can't escape it. It's two sides of the same coin. As they would say, it's a duality. If you don't have Black people and you don't have white people, it's difficult to have anti Black racism. But anti Black racism also impacts American Blacks. And I think it's important for us to embrace that as a way of being and to think about ways that we can change our thinking so that it's not so impactful and that it's not happening to us unconsciously. So, the other aspect of anti Black racism that I'd like to talk about briefly is health insurance. Health insurance, a lot of times, is only available to people who have a job or people who have a lot of money or people who are on other people's health insurance. And in some cases, you might be able to be on um, affordable health care with the Affordable Health Care Act. Some of those are in jeopardy at times or whatever, but the problem when you're sick a lot of times is not being able to avail yourself of adequate health insurance. So I would like to encourage you to now begin setting up a care team and setting up, if you haven't already, annual wellness checks, making sure you have access to the doctors, looking at websites. And in my book, I provide you with some resources that you can take a look at to find those within your area and to allow what happened in the past to not necessarily control what you do today, but also to make sure that you use what you know with the past to help you move forward today. Having adequate health care is really crucial. And when you're looking at a fatal or near fatal diagnosis, having those things already set up is going to really help. So, the last thing I'll say to you is I want to read to you from page 133 of the book, which says, at first, a diagnosis will overwhelm you, and then the medications may make you feel like you don't want to do anything, or make it so that you really can't do anything. You may feel like your life is without meaning, or you wasted it, or so will many other of these sort of thoughts maybe run through your head, and they may arise um, and they feel pretty normal. It's actually normal to be thinking this at such a point. And what is important is that you have to rely on your practice when you're laying there and when you're dealing with doctors and you're dealing with medications to remember who you are. And that practice includes Zazen meditation and your dance Dharma. And these can all be done, these can both be done in your bed or in a chair or whatever is available to your body to help you. And if you don't have these practices established before you have a pretty serious diagnosis, it might be difficult for you to begin practicing then. So I encourage you to get your practice set, do your dance Dharma, do your Zazen meditation, and be mindful of how anti-Black racism impacts the way you think about taking care of yourself in the medical industry. For me, it was really important to see how I needed to push through my set of beliefs, if you will, to advocate for myself. And so I hope that you're able to do that. I'm Carla Stalling Walter, and I look forward to seeing you again on the next video. Thank you so much.